Hello, I am Dr. Sreekumar. I am a specialist physician at Aster Medical Center, Karama. The main purpose of this talk is to give you a highlight on what that is the HIV/AIDS. Every year, the 1st of December, we celebrate the World AIDS Day and we wear the red badge. What exactly that you mean by wearing the red badge? It is actually the support or the kind of solidarity that you express to people living with HIV/AIDS. What is HIV and what is AIDS? Before 1981, the world never knew that such a disease existed. So when there was increased incidence of two major diseases, pneumocystis pneumonia and Kaposi sarcoma, which happened in previously healthy male homosexuals in Los Angeles. Actually, the people tried to find out the cause of this, and in 1983, the virus was actually isolated. That was the human immunodeficiency virus. What is HIV and what is AIDS? HIV is the virus that causes AIDS, but it has to pass through several other stages before it reaches the AIDS stage, that is acute immune deficiency syndrome. That is the most advanced stage of HIV disease, where our body immune system is very less actually and our body easily succumbs to a variety of opportunistic infections and tumors. One thing is very clear, the so-called bacteria and viruses which never used to cause severe forms of disease become very active in the late stage and itself can result in death, especially when it is associated with HIV in the advanced stage. This is called AIDS, where our body's immune system, especially the CD4 count, becomes very less and our body easily succumbs to death and various infections. And as far as the route of transmission of the disease is concerned, most of us will be knowing that the commonest cause in the world is still sexual transmission. And other modalities like contaminated needles, blood transfusion, mother to child transmission also are there. Most of them are preventable to some extent. For example, the commonest route is sexual transmission, and to large extent is avoidable if you follow a very faithful sexual relationship with your partner, using condoms while having sexual activity. And actually that kind of behavior is very important to prevent or contain the disease. It's because this disease, once it gets into the body, even with the kind of advanced treatment that we have, it is remaining incurable. We do not have a vaccine to it. We still do not have any proper treatment that can actually cure it. The kind of treatment that we have these days is something that can actually prolong the life of the people who is living with HIV/AIDS. Only that time period from normal HIV, when the early asymptomatic HIV infection to the advanced AIDS stage can be delayed. So in this World AIDS Day, my advice and what I am going to tell is that it's a disease that is preventable and may not be curable. So let us take all our pledge to have a very faithful sexual relationship with our partner, and let's hope that we will be able to contain the disease and prevalence and incidence will come down in future. Thank you.